Okay, the question which is asked today is what are the absolute contraindication of abdominal paracentesis, means ascitic tapping, which you say in normal language. So what is the PT-INR cutoff, what is the platelet cutoff, and what is the blood pressure cutoff? So technically speaking, there is no absolute contraindication of ascitic tapping, whether diagnostic or therapeutic. In diagnostic, you remove a little amount of ascitic tap. In therapeutic, you drain 3, 4, 5 liters of ascitic tap. But there are some relative contraindication. So the first is the PTINR. So technically, if you go by the guidelines per se, so the cutoff is very high. It's somewhere around PTINR more than 8. Why it is so? Because they say that the cirrhotic patients are in a state of rebalanced hemostasis. What that mean that obviously we know that they have a procoagulant deficiency, factor deficiency, procoagulant factor deficiencies. That's why the PTINR is high. So they have a the blood doesn't clot. But at the same time, they also have anticoagulant deficiencies like protein C, protein S. So there is chances that they may clot also. So the bleeding part and the clotting part both counteract each other. So the tendency of bleeding during ascitic tapping in this patient is technically very, very low. So there is no need to transfuse as per the guidelines, but the relative cutoff is INR more than 8. Now, regarding the platelets, so it's somewhere around 20,000. If they are more than 20,000, we can tap it. But if they are less than 20,000, then we tap with the cover of the platelet pool. Now, the most important of all these is the blood pressure. So, any patient who has a systolic blood pressure of less than 90, then it is a relative contraindication. We should stabilize the blood pressure either via the vasopressors or fluid or albumin, whatever means. The reason is if at this blood pressure we drain the ascitic fluid, so there is a term called PICD, paracentesis induced circulatory dysfunction, in which the blood pressure falls, and because of the low splanchnic blood flow, the patient may land in hepatorenal syndrome and can have a kidney dysfunction. That's why a large volumes of paracentesis, more than 5 liter, are done under the albumin cover. And if the BP is too low, we take some noradrenaline support. So I hope this clarifies. So definitely we should read more about it. Thank you.